All right, so we have two different sizes of heat packs that we use. This is the bigger one that we use for the knee, the hip, the back, just larger body parts. And when we set it up, we always put the heat pack in the cover, and then we have this extra layer, and then we put one layer of towel. If we're worried about the patient getting too hot or burning, we can put at least one extra layer of towel. Usually we do this if they're going to be laying down on the heat pack and putting a lot of pressure on the pack. The other one that we have is this smaller one. This is used for the neck, the shoulder, the ankle, just smaller areas on the body. And with this one, we just put the heat pack in this little pocket, and then we put the towel on it like this. And same as with the ice, you always set a timer and check them about halfway through to make sure it's not too hot. And we also will use these straps that are found by the aid table if it's on an area of body that the heat pack might fall off.
So I looked at the patient's chart, and she needs heat and IFC for her elbow. And IFC and IES are the same things. It's the electrotherapy. So I'm going to come over here to the hydroculator, and I'm going to grab the heat pack, and you can use this little thing to help you grab them so you don't burn your fingers. You're going to let it drip off a little bit, and then you're going to put it inside this little case, and you close this, and you come over to the cupboard, and you're always going to grab a towel so it doesn't burn them, and if they're laying on it, you want to have multiple layers for protection. And you're going to grab an alcohol wipe, and you're going to clean the areas where you're going to put the electric pads. I'm just going to go here, here, and on the inside, right there. And then you'll throw these away later. Next, you're going to grab the pads, and then before you put them on the patient, you're going to clean them with hand sanitizer. So you just do a little squirt. Kind of rub them together until it dries, and it helps them stick better as well. And then if you're doing IES, you're going to crisscross the pads. So with every machine except for this one, you're going to crisscross the colors, so black and black. But on this machine, like I said, it's different. You're going to crisscross the numbers. So there are little numbers right there. So this is 2 and this is 1. So I'll put them here, and then I'll put the other 1. So it'll be 1 and 1 and 2 and 2. And if the pads aren't already on the cords, then you can grab them in the little box next to it and put them on. And once those are dry, I'm going to put them on. So this one is 2, and I put 2 right here. So I'll put this right there, and then 1 across from 1. After the pads are in place, you're going to take the heat pack and wrap it around the injured area. And you want to make sure the pads stay in place so it has good conduction. Then you wrap that around until it's snug. Is that comfortable for you? Mm-hmm. Okay, you're going to come over to the machine. And so before you click anything, you want to make sure it's on the right channel. So earlier we were using 1 and 2. So it's on 1 and 2. If we were using 3 and 4, it'd be these cords. And I would just click right here where it says select channel to get where I want. So I want 1 or 2 because we're using them both. Then I would click electrotherapy, and I would come over to interferential because we want IFS. And it will be set up on the usual settings. If you need to change it at all, like they have more time or you want to do high-low, then you would click edit and you could adjust that here. But if that's what you want, then you can go ahead and start turning up the intensity. I'm going to start turning it up. Let me know when you can feel it. And as you're turning it up, you want to watch the conduction right here on this little black bar. And if it gets low, you want to check the pads to make sure that they're still touching. So usually it drops a little at the beginning, but once it goes up higher, it should go up.
I can feel it.
Okay. And let me know when it's comfortably strong. And once they can feel it, you want to start turning it up a little bit slower so you don't suddenly shock them.
That's good.
Okay. And then you're going to press start. And at this time, this is when you could ask them how they've been doing since their last visit. And you always want to set a timer. So you can grab a little electric timer. It's going to be for 10 minutes, and then you can just set it on the table. Once the timer's gone off and the patient's treatment is done, you're going to come over here and you're going to ask them how it went. How'd that feel, Megan?
It's good.
Good. And then you're going to take off the heat. Just unwrap that. And you'll set it right here, and then you're going to put it away after you put away the pads. So now I'm going to take off the electric pads. And you're going to put them on their plastic container thing. And make sure to pull the pads off by the pad and not by the cable so that it doesn't ruin them. Then you're going to wrap it up neatly right here. And you can tuck these into the little drawer. You're gonna make sure and put the heat away, and then you'll get started on the patient's exercises with them.
This is how to set up IFC or IES on this machine right here. The power button's on the back right here if you ever need to turn it on. And with this machine, it's pretty simple. Right here, it'll say IFC. You click that. It's already set for 10 minutes and it's already set for high. If it needs to be high-low, you would just click this here to alternate, or you can go to low if that's what the specified thing is. And then you also want to make sure you're using the right channels, 1, 2, 3, and 4, and you can adjust that right here. It'll switch. And then after the pads are set up on the patient, you start turning it up and you let them know to tell you when they start to feel it. And afterwards you keep turning it up until it's strong but comfortable, and then you push start. Right there.
So this is how you set up IFS on this machine, the dinosaur machine. So every time you come over to this machine, you're gonna have to turn it on. So the switch is right back here. I like totally missed it once I bent over. It's right here. So you're gonna turn it on. We leave it turned off because it's really loud. Then you're going to pick the side you're doing. This is side A. This is side B. So we're gonna use side A today. So I'm gonna press here. Then I'm going to click interferential. Then I'll select channels 1 and 2. And then you're going to come up here to the regular preset setting. So it's this one right up here. Then you're going to start turning it up, and you want to make sure that you're watching the conduction levels here and here, and these numbers right here to make sure that both pads are going up evenly.
When you are setting up patients on electrical stimulation, it's important to set good expectations for what they should and shouldn't feel. Let them know it should be strong but comfortable. If you haven't ever felt it before, it would be a good idea to put it on and have someone turn it up for you so that you can understand what it is and explain it to a patient. Also, with the electrical pads, a common mistake I see is that the pads are often placed too close together or too far apart. If they're too close, the electricity can't get down into the area, and if they are too far apart, then oftentimes you're missing the spot that we are wanting to get. So just if you have questions, ask your therapist about the pad placement. If the patient isn't feeling anything, it often can be a problem with the pads, so check those first. But if you have the intensity turned up high and you've checked the pads and it is not working, please let your therapist know so that they can help you get that fixed and working. Sometimes your patients will want the electric therapy turned up halfway through the treatment because it starts to not feel as strong. So on your halfway check, if they are needing that to be bumped up, you can bump it up, but don't let the patients bump up their own electricity. That should be something that the therapist or the aide should do. And last thing I would mention for this is make sure that you place the heat or the ice on the area before you turn up the electrical stimulation, because as you shift or place things on the pads, that can change the intensity. And so you don't want to shock them from doing that. So those are a few things to take note of, and make sure that you're setting clear expectations with your patients.